Everyone, thank you so much for taking some time to learn a little bit more about the current funding opportunity that Olympic Community of Health released last week. My name is Celeste Schoenthaler, and I'm the executive director here at Olympic Community of Health, and I'll be the person leading today's webinar. The format for this is pretty simple. I will do a quick walk through the funding opportunity and then want to turn it over to hear questions from you all. You are welcome to put those into the chat, or you can raise your hand, and as soon as I'm done just doing this brief walkthrough of the opportunity, we can go through those. So we'll get started here. So this funding opportunity lives on the OCH website under our resources tab. There's a funding opportunity tab there. And currently we have the one funding opportunity over related to building infrastructure to address health-related social needs. And this web page includes the overview and instruction document that we'll go through, and then some of the details about the application. But really, everything lives best in this, this document online. So to briefly discuss the purpose of this, Olympic Community of Health was allocated this very specific dollar amount from the Washington State Healthcare Authority so that we could in turn put out a funding opportunity to support the development of health-related social needs service infrastructure for services that are authorized under the state's Medicaid Transformation Project. So we will look to contract with organizations and tribes within the three-county region for three specific health-related social need services: medical respite, nutrition supports, and housing transition services or rental subsidies. The big thing to know about this funding opportunity is that this is not dollars to pay for the actual delivery of the service. That's happening under different elements under the Medicaid Transformation Project. This funding opportunity is here to give partners an opportunity to establish or grow or change the infrastructure needed to deploy services. A little bit about Olympic Community of Health is listed here. And our community care hub in this region is called Olympic Connect. And Olympic Connect provides case management services to community members who have social and health needs. And we refer people to different community resources. We have a regional resource directory on our Olympic Connect website. And eventually, new services, once infrastructure are established, would be added to our regional resource directory. And case managers and care coordinators can send referrals over to those new services. There are four categories of infrastructure that the Healthcare Authority has allowed us to include in this funding opportunity: technology, development of business or operational practices, workforce development, and outreach and education and convening. And we've put examples of the activities that are in our contract with the Healthcare Authority that elaborate on what these different infrastructure categories entail. This is a little bit about what applications should include. We need to know which health-related social need or needs the project will address, a summary of your work in this area and whether the service is new or if you aim to grow or sustain it, and what you've been doing to date on this service, how the project will support improved health outcomes. And we will also ask you to tell us what geographic and population focus for the service you're proposing, and what your experience is in reaching and serving the Medicaid population. We'll ask you to provide an overview of how you'll use the dollars, including a project plan, and then a budget in a separate attachment in Microsoft Excel. And finally, we will ask you to attest that you meet the eligibility criteria. So eligibility is open to organizations, tribes, and government entities in the Olympic region, Clallam, Jefferson, and Kitsap, who are working to advance health through collaborative action. You must be in good financial standing, have presence in the region, and be an established legal entity in Washington state. The Washington State Healthcare Authority has placed additional restrictions on eligibility for this, and those are outlined in the next bullets. Contractors must either be currently enrolled in Provider 1 or can commit to being enrolled in Provider 1 within 2 years of receipt of the funding. Unfortunately, our contract with the Healthcare Authority outlines that if you can't do that, the funds have to be returned back to us. Contractors must also have a signed provider agreement to provide a health-related social needs service. And we've limited this opportunity to those 3 services. And that's the same requirement, that it has to be met within 2 years of receipt of the funds, or they have to come back to us. And then finally, contractors must be contracted with a waiver funded payer to provide the service that the infrastructure funds are being used for. For medical respite projects, that would be at least one contract with a Medicaid managed care organization in Washington. For nutrition supports, it would be a contract with a local area agency on aging. And housing services and rental subsidies, you must be contracted with foundational community supports. And similar to the other 2 requirements, you have to meet this requirement within 2 years of receipt of the funds. The staff at Olympic Community of Health will provide some support to partners who are selected for funding under this opportunity. We are available to provide support and technical assistance. We will track your efforts and ensure that all services are included in our regional resource directory. We will help to identify areas that are interconnected and support you in creating synergies, provide you with a variety of opportunities for learning and convening, and contract monitoring in alignment with our contract with the Healthcare Authority. The funding model, applicants are asked to submit a budget in Microsoft Excel as part of the application. And once we have a contract in place, we will make a total of 2 payments based on the awarded amount in the contract. Half of the dollars will be allocated within 30 days of contract execution, and the second half will be issued upon receipt of a final report. We don't have a firm deadline for that final report. It will depend on what you outline in your project plan. We have a fairly small dollar amount for this funding opportunity, just a little over $174,000. We serve a 3-county region, and it's always our goal to allocate dollars across the region. And I'm thinking right now that the awards would be about $75,000, but you can always request more and we can negotiate award. The time frame, this was released on February 26th. We have frequently asked questions document that is currently blank because we haven't received any questions yet, but we will update that as questions come in. Proposals are due by April 6th, and we will review those in the middle of April and notify everyone who applies by April 20th. We will start contracting on the 21st, and we're anticipating that the contract period would be something like middle of May 2026 through the end of May 2027, but that's negotiable as a part of contracting. We've outlined here what the scoring criteria and how we will evaluate the proposals. We do ask that you submit 2 attachments, a PDF with the narrative and an Excel for the budget. We will conduct a technical review as proposals come in, and we'll let you know if anything is missing. Incomplete proposals will not be reviewed or scored. We've already talked about the eligibility. We will ask you to attest to those as a part of your narrative. That's not scored, it's more of a pass-fail. Similarly, letting us know which HRSN service or services you plan to address via the project. That is also pass-fail. Qualifications and the details of that are outlined on the screen here. And the qualifications are valued at 15 points. What the project aims are is valued at 10 points. Your approach and plan is also 10 points. Collaboration with other partners is 5 points, and budget is 10 points for a total of 50. In addition to the scoring criteria, like I mentioned earlier, our final decisions will also be based on regional needs and in alignment with funder-directed criteria. And it's possible that the OCH staff will reach out to applicants for clarifying or additional information. During application, the open application time period, there are a few ways where you can ask for technical assistance or ask questions. Today is one of those. The FAQ is another, and email. All questions that come in via email, once we respond to the individual, we will also put those questions and answers into the frequently asked questions document. And finally, for transparency, we always like to let folks know what to expect when you get to contract with us. We will check for suspension, debarment, ineligibility as per standard procedure. We will ask you to provide proof of insurance, including your commercial general liability insurance. If your proposal includes any driving or mileage, we will ask for a copy of your auto coverage. Once we get to contracting, we'll ask you for a completed and current W-9, and we will ask you to fill out our electronic payment form. OCH processes all payments electronically. And then adhering to the eligibility requirements outlined in this document. The process is to complete a proposal and submit that as a single PDF attachment and a budget in Microsoft Excel, and email those to the email address listed here no later than 5 p.m. on April 6th, and we will notify everyone by April 20th. So I'll go ahead and stop there, and we'll see what questions you all might have about this. And again, you're welcome to use chat. It's probably easiest if you just unmute. We're a small group here, I see, so ask away.
Thank you so much for holding this session today. I wasn't sure if I was reading it correctly, but I did read it correctly. But just wanted to confirm that it's not for the actual service, but that it is for the infrastructure. So that's actually wonderful.
Yeah, Tracy, their healthcare authority has contracted with a myriad of other organizations to actually pay for the service. So for some services, those are the triple A's, so Olympic Area Agency on Aging in your case. In some cases, it's the managed care organizations, and then foundational community supports is the other. But OCH will not be paying for services.
Yeah, no, this is perfect. I think that I know that we have a need for some of that infrastructure support. So this could be a really great fit. But I'm going to share internally with my team and make sure they're all on the same page too.
Okay, glad to hear it, Tracy. Any other questions or clarifications?
Hello. I just wanted to get a little clarification. So for medical respite, you mentioned we just need to be contracted with one MCO.
Correct. Yeah. When we wrote this RFP, we took this straight from our contract with the healthcare authority. So yeah, for medical respite, at least one Medicaid managed care organization. The Olympic region, all 5 of the managed care organizations have presence in this region. So it just needs to be with at least one.
Awesome. Thank you.
I know I have a question, but I'm reviewing.
That's fair. Yeah, that's fair. No
Try
pressure.
to look for it. So the contract must already be in place,
Well,
if
so
I'm
that,
understanding correctly.
yeah, so you're talking about the eligibility. Where did I put that?
On
Oh, here we go.
page 3,
Yeah.
yes.
So it's all three of these requirements are the same. So you have to have either have it in place now, which is the easiest way to do it, or you have up until 2 years from the receipt of the funding to be enrolled in provider one, to have a signed provider agreement, and then be contracted with a payer who will reimburse you for the services once the service launches. And
And then
unfortunately, my contract with HCA is very clear that if that doesn't happen, you have to return the dollars to us.
so how will I know which local area agency on aging
Which
um,
county are you in?
hits at?
That's the Kitsap Division of Aging and Long-Term Care. Kitsap has just one. There's two AAAs in the Olympic region. Kitsap is through Kitsap County, and Clallam and Jefferson are served by the Olympic Area Agency on Aging. Kane, I see you have your hand up.
Hi, Celeste, it's Bryn. Quick
Hey, Brand,
question. Oh, sorry, I think I'm
you're
listed under
listed as
Kane.
Kane on the screen.
Um, my question is, um, will the application be evaluated within a closed universe? And by that I mean, PCHS is a participant in Olympic Connect. Is that information that should be included in the application versus it's already known that PCHS is a participant? Because that ties directly into the services that PCHS intends to offer. Does that make sense?
Yeah, it won't impact our decision. So
Okay.
there's no like extra credit in the application scoring rubric for existing Olympic Connect care coordination partners.
Understood. And that was not quite my question. My question
Sorry.
is, should I mention that if it's not mentioned in the application, will it be assumed that it's not that PCHS is not part of it?
No.
Okay. Okay.
Yeah, the applications are reviewed by OCH staff, and everybody
Okay.
knows that PCHS is a part of Olympic Connect.
Okay. Okay, great. Thank
There's
you.
no secret staff you haven't met before at OCH.
Okay. Yeah, it's just more
Or
that
small.
how the submission would be evaluated. Great. Thank
Yeah.
you.
Yeah. Any other questions, folks? We will go ahead and end the session, and the recording of the call today will eventually be linked on the frequently asked questions document, probably by early next week. And we will add the questions from today to the FAQ to get started, and then other questions can come in via the OCH at olympic.ch.org inbox between now and right before the applications are due. And I wish you all happy writing on your proposals. Take care, everybody. Have a good day. Thank you.